Hi, I'm Dr. Corey. Today, I'm going to be talking a little bit on behavior therapy. When practicing behavior therapy, I mainly want to focus on observable behavior, things that could be causing that behavior, learning experiences that promote change, and in turn, tailoring a treatment strategy to fit the individual client, as well as maintaining treatment through rigorous assessment and evaluation. The four areas of development which are used to develop treatment techniques are classical conditioning, operant conditioning, social learning theory, and cognitive behavior therapy. Drawing from each one of these, behavior therapists can design a therapeutic procedure for a particular client rather than being randomly selected from just a bag of techniques. Now, this allows for the therapist to be unique in his treatment and the actual therapy to be somewhat creative. Let's go ahead and take a look at some of these treatments in a few of my clients. Alright, David, so what brings you in today?
I feel dirty all the time, so I just find that it's necessary that I have to just clean my hands all the time. I have to. It has to be done. I have to clean my hands right now.
Okay. So, is what I hear you saying is you seem to always feel dirty, and to kind of cleanse yourself or to feel relieved, you have to wash yourself or wash your hands. Is that what I'm getting?
Yes.
All right. Well, I'd like to try a treatment. It's very effective for these kind of things. For something like OCD, it's called punishment. And what we're going to do is we're going to do what I call positive punishment. So we're going to add an adverse stimulus every time you perform this behavior, this hand washing. And so I'll just perhaps follow you around or be wherever you are to kind of enforce this this adverse stimulus to kind of create this punishment to get you away from this behavior. How does that sound?
Yeah, sounds good.
All right. What are you doing? What are you doing? You need to wash your hands. You need to wash your hands! You don't need to wash your hands! Alright, Jorge, so can you tell me a little bit about what brings you in today?
Well, I have a certain disposition against, towards women.
Can you elaborate a little bit? I mean, what is it about women? Are you...
It's not that I'm afraid of them or anything like that. It's just when they're around, I just want to, go. Just
like escape, so you...
escape, but not like it's a bad thing.
Okay. So what I understand that you're saying is that maybe you have like an anxiety or maybe a certain amount of fear built up around or a discomfort around being with women. Is that kind of what I understand you saying?
You can pose it like that.
Okay. And so when you're around them, you feel like you have to get away. You have this anxiety, and you just have to get away from them if you're around a woman, right?
Yes.
All right. Well, I think I've got a little something for that. We got this exercise we're gonna try. It's called in vivo flooding, and so what we're gonna do is try to immerse you into this anxiety-provoking stimuli. And we're not going to allow you to escape or do any of your self-help behaviors. So, in essence, it'll hopefully push you over the envelope and get you over this fear. How does that sound? All right.
Sure, it's gonna work.
Let's give this a go. So, Exposure therapy is designed to introduce the client to the fear-invoking situation to help them overcome their anxiety. So as you see, we have taped Jorge to this chair so he can't escape his fear. And we are now going to bring in the adverse stimulus that he seems to fear so much.
Oh God.
Stage 2. So Cody, what brings you in today?
Well, I'm kind of embarrassed to say this, but I'm a real pushover. Like, my friends call me tool bag. I always pay for lunch. I'm the one calling my friends all the time. They never call me back. And so I usually just show up at an event that I know I'm not invited to.
So what I hear you saying is, you know, you're kind of a pushover, you know, like
Mm-hmm.
you don't you're not assertive. You don't make yourself known or your presence known and your attitudes or feelings. Is that kind of what you're saying?
Yeah, that's actually right on the tee. That's almost textbook.
Okay, well that's great because I think we're gonna work on your assertiveness and give you a little assertive training. Let's just go ahead and work on something like right now. Like say I'm your roommate.
Okay.
You know, and I've just told you, hey, you know what? You need to move. You need to get off this couch because I want to use it and I want to watch TV. Go ahead and try to.
Yeah, I'd be like,
So-
absolutely. I know where my place on the floor is, and then you take the couch.
Okay. Well, let's reverse roles. You go ahead and play him, and I will play you, and I'll try to do it in such a manner that's
Okay.
a little bit more proactive here.
Okay. Well, he'd be holding like a Mountain Dew, and his Xbox controller would be like, hey, I need to play Xbox, and I want the whole couch on the floor.
Well, you know what?
Did I say you can talk? That's what it usually is.
That's how. Okay.
And I would just be pushover.
Okay. Well, you know what? I think it's time that you let me use this couch, and you just need to step off. You know.
Or what?
Alright, that's good. See, you're already. You know, you feel how you're getting assertive right there.
Yeah.
Yeah. All right. Let's take it up a notch. You know. Let's
Okay.
try taking it up a notch.
All right.
All right. So I'm you be you again, but be an assertive you, and I'm gonna be your roommate. All right.
Okay.
Hey, listen, Cody. You need to get off this couch right now.
I don't think so.
All right, Cody. So we've gone over a lot of good things today, trying
Yes.
to build up your self-esteem and get you ready to be more assertive.
Mm-hmm.
I think we make this a practical exercise and go ahead and take this out, you know, into real-world situations. See how this works out.
I would love that.
All right.
All right.
Hey man, can you get up? I need the couch. I gotta play.
Not today.
I really got. You gotta go. Just
No.
take your paper somewhere.
No.
Just-
Hey, I have a loaded gun in here, and I will shoot you if you don't
Here we go.
stop picking on me.
Okay.